Hi, my name is Carrie Walker, and I work with the Villages Health. And today I'm going to be talking about the effects of alcohol in the body. Please keep in mind that this presentation is designed for educational purposes only and is not intended as a substitute for advice from your primary care doctor. By the end of today's presentation, I hope that you'll gain a better understanding of the effects of alcohol on different parts of the body, the impact of alcohol on existing health conditions, as well as practical guidelines for alcohol consumption. I don't think anybody would argue that overall alcohol has a negative impact on the body, but I think you may be surprised at how many different parts of the body are actually affected by the alcohol. At lower doses, alcohol can act as a stimulant, inducing feelings of euphoria and talkativeness. Often people feel this is a positive, especially in social gatherings, but there's another side. Drinking too much alcohol at one session can lead to drowsiness and, in extreme cases, respiratory depression. It's important to understand what a standard drink size is when you're trying to figure out how much is too much. When it comes to the different types of alcohol, each one has a different percentage of alcohol in it. A 12-ounce beer averages about 5% alcohol content, which is known as about 10 proof. Proof is double the alcohol content. Malt liquor is a little bit more at 7%. A 5-ounce glass of wine almost doubles that at 12%. And a 1.5-ounce cocktail, your standard size cocktail, has a higher percentage of alcohol, 40%. So all drinks are not created equal, meaning that if you are having a cocktail, you are having a drink with considerably a lot more alcohol in it than a beer. This is important to remember when you're calculating whether or not you should drive. I also want to point out that when you're looking at this slide, a 5-ounce glass of wine and a 1.5-ounce cocktail is probably a lot less than the average when you're served out and about, or that you pour yourself. So you want to make sure that you're considering that when you're looking at your consumption levels. Let's take a look at what happens after a drink is swallowed, a drink of alcohol. 20% of the alcohol is absorbed into the bloodstream from the stomach. 80% continues on to the small intestine. Effects are felt within 5 to 10 minutes. Alcohol peaks in the blood between 30 to 60 minutes when it's then carried through all the organs of the body. The liver breaks down about 90% of the alcohol. However, 10% is actually excreted through lungs, kidneys, and sweat. This explains why sometimes if you encounter somebody that has been drinking heavily the day before, you can actually smell the alcohol on them because it's coming out through the pores. The liver can only process one standard drink per hour, which is important to remember when you're consuming alcohol. If you're drinking on average more than one drink per hour, you are going to notice significant impairment in abilities. We'll take a look at other variables that can impact that as well in the next slide. When you take a shot of alcohol, I found it interesting that it's not actually the alcohol itself that's burning your throat. Instead, the ethanol in the liquid is making your throat's heat receptors more sensitive, prompting them to perceive your own body temperature as hot. So it's not actually the alcohol that's burning your throat on the way down. 30 seconds after your first sip, alcohol races to your brain. It slows down the chemicals and pathways that your brain cells use to send messages to each other. This alters your mood, slows your reflexes, and throws off your balance. You also can't think straight, which you may or may not recall later because you'll struggle to store things in your short-term memory as well. The effects of alcohol vary from person to person depending on a variety of factors listed below, including how much you drink, how often you drink, the presence or absence of food in your stomach, the concentration of alcohol in your drink, which we call proof, or the percentage of alcohol we took a look at previously, how quickly you drink, your age and sex, your health status, and your family history. High blood alcohol concentration changes as we age. As we age, muscle mass is replaced by fat tissue overall. This means that an older person who drinks the same amount as someone younger will generally have a higher blood alcohol concentration. The amount of water in our bodies also goes down with age, contributing to this higher blood alcohol concentration. Since men have a higher percentage of muscle, their blood alcohol percentage is generally half as much for women for the same amount consumed. What exactly is happening to our body when we experience the symptoms known as a hangover? Well, alcohol makes you dehydrated, which causes blood vessels in the body and brain to expand, which give us a headache. Your stomach wants to get rid of the toxins and acid that the alcohol churns up. This results in the nausea and vomiting in some cases. Your liver is generally so busy processing the alcohol, it doesn't release enough sugar into your blood, which can bring on the weakness, weak feeling and the shakes. Alcohol overall affects almost every part of the body because it enters into our bloodstream. And as it circulates in the blood and reaches the different organs, that's when you'll notice different symptoms happening. Or the symptoms will happen. Some are not going to be noticeable necessarily. In the next few slides, we'll unpack the specific impact alcohol has on the different parts of the body, beginning with the brain. I mentioned earlier that 30 seconds after the first sip, alcohol races into the brain. And as it reaches the different parts of the brain, you'll notice different changes in how your ability to function. Each part of the brain has a different function, and depending on depending on the function of each different part of the brain, that determines the effect of alcohol. Let's start with the hippocampus. Memory is controlled by the hippocampus, so drinking a lot of alcohol at one time can cause you to black out in the extreme case or to forget a period of time. Long-term alcohol abuse can permanently damage this part of the brain, making it difficult for a person to learn new information. The hypothalamus controls different body functions such as heart rate and the feeling of hunger or thirst. So alcohol consumption in this area of the brain can end up slowing down your heart rate and may make you hungrier and thirstier, accounting for the munchies that some people often crave. Alcohol affects the central nervous system, slowing down this system, which includes the brain, spinal cord, and nerves. This affects how the signals flow through your body, making you think, speak, and move more slowly. As alcohol affects the medulla, the medulla controls involuntary processes of the body, such as breathing and maintaining body pressure. Drinking a lot of alcohol at one time can shut down the medulla in extreme cases, leading to a coma. The cerebellum is the part of the brain responsible for coordinating many of our daily movements, such as walking and grabbing objects. Alcohol can slow your reflexes and can cause you to lose your balance or make your hand shake. The cerebral cortex is the main area of our brain responsible for thinking, decision-making, emotions, and the five senses. Alcohol's effect on this area can impair your ability to think clearly and lower your inhibitions. It may make you act without thinking or make you angry for no reason or cry for no reason. Alcohol may affect your senses such as blurring your vision, and long-term abuse can permanently damage this region. I mentioned earlier that alcohol enters the bloodstream. Moderate alcohol consumption can seem to result in a blood thinning phenomena, but excessive use can have the opposite effect. Once alcohol is in the bloodstream, it can cause platelets and red blood cells to clump together, increasing the chance of clot formation and subsequent stroke. People who have AFib are particularly at a greater risk with alcohol consumption. Chronic heavy alcohol use also suppresses the immune system by decreasing the number of blood cells in our gut. Our gut is where the majority of our immune system lives in our body. Chronic drinkers are more liable than to contract diseases and viruses. And because alcohol is circulating in the bloodstream, it also can lead to changes in body temperature. Compared to women who don't drink at all, women who have even 3 alcoholic drinks per week have a 15% higher risk of breast cancer. And of course, this risk goes up with each additional drink of alcohol. I read one research study that shows that women's chance of breast cancer increases 7% with each drink. Alcohol increases, and that's because it increases the levels of estrogen and other hormones associated with hormone receptor positive breast cancer. Alcohol can also increase breast cancer by damaging the DNA in cells as it circulates through the body. Overall, alcohol is connected to 7 different types of cancer. As the alcohol circulates through the different parts of the body, as it passes through the different regions and comes into contact with cells in those regions, it can damage the cell DNA, leading to the cancer. Alcohol also affects the heart. Light to moderate use of alcohol, which is now considered 1 drink per day for both men and women, can reduce the risk of coronary artery disease by altering the lipid and clotting factors in the blood. However, drinking a lot over a long period of time or too much on a single occasion can lead to these effects: stretching and drooping of the heart muscle, an irregular heartbeat, and high blood pressure or stroke. Binge drinking affects the vagus nerve, and the vagus nerve affects the heartbeat. So that's how that particular phenomenon works. Alcohol is a diuretic, causing frequent urination, leading to dehydration. Your brain normally gives off a hormone that keeps your kidneys from making too much urine and dehydrating us. But when alcohol swings into action, it tells your brain to hold off. This means you have to urinate more frequently, leaving you dehydrated. When you drink heavily for years, that extra workload and the toxic effects of alcohol can wear your kidneys down. Because you're excreting more liquid, this can lead to the loss of magnesium, calcium, phosphate, sodium, and potassium. And all of these minerals are essential for regular body function. Magnesium is required in 90% of our metabolic function, and all of these nutrients are needed for normal heart function. All right, the liver. Alcohol causes inflammation in the liver. And this inflammation leads to the following things: fatty liver, alcoholic hepatitis, fibrosis, cirrhosis, and cancer on a continuum. The effect on the liver begins with fatty liver disease, and then as it progresses and gets worse, it can then go from one to the other, eventually leading to cancer. Let's take a look at what that looks like. You see a normal liver here, nice smooth tissue. Your liver breaks down almost all the alcohol you drink, as I said, 90% earlier. In the process, it handles a lot of toxins. Over time, the heavy drinking makes the organ fatty and lets thicker fibrous tissue builds up. This limits blood flow through the liver so that the liver cells don't get what they need to survive. And as they die off, the liver gets scarred and stops working as well, causing the disease known as cirrhosis. And then after extreme alcohol consumption, the cirrhosis can lead to cancer in different parts of the liver. I included this next slide as a visual. For any of you who are considering not heeding the advice in this PowerPoint presentation, sometimes we think of alcohol not in terms of physiological impact on the body, but in terms of how it seems to be helping us feel or not feel. And I just wanted to let you know that over time, the buildup of the toxins in the liver can render it physiologically changed and not functioning. So there's a reason why it's advised to use caution when consuming alcohol, because it can actually physiologically change the structure of the liver, which will then change its ability to function. As alcohol is consumed and moves through the mouth, throat, and then the esophagus, it's an irritant that damages the delicate lining of the esophagus. Prolonged heavy consumption can lead to various head and neck cancers. One research study showed that drinking 5 or more drinks a day can double or even triple the risk of developing cancers in those areas of the body. Alcohol causes the pancreas to produce toxic substances that eventually lead to pancreatitis, or a swelling or inflammation. Pancreatitis is a dangerous inflammation and swelling of the blood vessels in the pancreas, which prevents proper digestion. The pancreas has two main functions. First, to supply digestive enzymes to the stomach, and the second is to supply insulin through the bloodstream to help convert glucose into energy. Damage to the pancreas from alcohol will impair function in both of these areas. Alcohol has a direct and indirect effect on the reproductive systems of our body. Because alcohol affects the judgment center of the brain in the frontal lobe, it can lower inhibitions and good judgment. So it increases indirectly the chance of having unsafe sex, which can lead to getting a sexually transmitted disease. Long-term sexuality and obviously complications with pregnancy if you are able to bear children. As alcohol travels to the stomach, it's absorbed into the bloodstream or continues through to the small intestine. Some alcohol remains in the stomach, which increases the stomach's acidity and irritants to the protective lining, causing your digestive juices to flow. Prolonged exposure of alcohol to the stomach lining can cause ulcers. When alcohol travels through to the small intestine, it can interrupt the digestive process and block the absorption of important nutrients from our food, including vitamin B1, 12, and amino acids. Although alcohol is fat-free, it is very caloric. Only fat contains more calories per gram. It increases your appetite and also lowers your inhibition, so excess drinking can lead to weight gain because of your change in eating habits. Alcohol also makes heartburn more likely because it relaxes the muscle that keeps acid out of your esophagus. Alcohol irritates the lining of your stomach and then, as I said, makes the digestive juices flow. This is what can lead to the buildup of the acid and the alcohol, causing the nausea and vomiting associated with the hangover. I included this slide because it illuminates the far-reaching effect of alcohol on the body. As you see here listed on the left are 4 different areas of lifestyle choices that affect our likelihood to get different chronic diseases listed on the right. And as you follow the green lines here, you can see that alcohol pretty much increases your risk for almost every type of chronic disease. This means, however, that by reducing or eliminating alcohol, you can greatly reduce your likelihood of getting almost all chronic diseases. The impact of alcohol also has an influence on existing health conditions. It may worsen or other health conditions not related to alcohol directly, such as diabetes, because of alcohol's negative impact on the pancreas. That'll interfere with insulin production. It also can cause more inflammation overall in the body, which can aggravate arthritis. As I mentioned earlier, alcohol, as it's processed through the body, increases blood pressure, which is not going to help if you have hypertension. And alcohol can damage different parts of the brain, which can negatively impact existing conditions such as Parkinson's and Alzheimer's, which are neurological conditions negatively impacting the brain already. Also wanted to mention that any other health condition that you have that's requiring you to take a prescription for it, be aware of any possible side effects that are going to be exacerbated by the taking of alcohol. Particularly if you're taking some prescription medication just short term for an infection. So you may not be accustomed to having to think twice about alcohol consumption because you don't normally take this medication. So I just wanted to add that extra caution in. Alcohol also can affect mental health. Initially, alcohol can act as provide a feeling of numbing. However, overall, as alcohol wears off, it can leave a feeling of depression. Alcohol initially can induce a feeling of drowsiness. However, as it is processed, it triggers a drop in blood sugar, which actually wakes you up, interfering with sleep patterns. Research shows that alcohol inhibits the hippocampus part of the brain, which is responsible for short-term memory. So over the long haul, alcohol is considered a depressant, even though initially it may give you feelings of euphoria and a stimulant. The long-term effects are going to have negative impacts on your mood, energy level, sleeping patterns, ability to concentrate, memory, and depression. Okay, hold on a second. I need to go to the next slide. Here we go. So this is nothing, this next set of information that I'm going to give you is probably not a surprise to anybody, but just wanted to summarize. If you really want to have lower risk drinking behavior, it's important to know what a standard drink size is and keep that in mind. Keep track of what you're drinking daily or weekly. With a lot of social events going on constantly, you might not actually be aware of how much you're drinking as much as you think you are. So just kind of keep track of it even for a week, especially during holiday times, and set limits for yourself and try to stick with them. One strategy that's helpful is if you start with a non-alcoholic drink and then alternate with alcoholic drinks. Oftentimes a person may consume more simply because they have a drink in their hand. So if you make a conscious choice to alternate or especially have water in between to help counteract the effects of dehydration effects of alcohol, you're going to drink less. Try to drink more slowly. You can mix a cocktail with more of the mixer. So maybe instead of having a short or regular size cocktail, go to a tall, so you have more mixer in there. Again, slowing down the time that might take to consume that drink. Make sure not to drink on an empty stomach because that will slow down the impact that alcohol has on you. Try to drink drinks with a lower alcohol content. We've noticed earlier that beer and wine have a lower alcohol content than cocktails do. Based on the impact of alcohol on the brain, I think you can really see the direct impact on one's ability to drive. So never drink and drive. Because the judgment center of the brain is impaired, you may think that you're okay, but not realize that your response time and your ability to accurately judge distances and the speed of oncoming traffic is impaired. Remember to be a responsible host. If you're having guests over, come up, kind of find out what the plans are, maybe have some designated drivers, and also have your guests leave their keys with you so that you have to kind of check in with them before they go. So I hope that you have found the information contained in this presentation helpful and have a better idea of how alcohol really impacts your body so that you'll make better choices. I find that by having more information on how and why something impacts our body, we're more likely to make better decisions rather than just someone telling us just don't drink alcohol or don't eat bad food, eat green leafy vegetables. I wanted to provide you more with the physiological reasons of why alcohol is not a good idea in excess. So thank you so much. And if you have additional any questions, I should say, feel free to reach out to the Village's Health and we can get your questions answered. Lastly, if you are able to scan this QR code with your phone, I would encourage you to do so because it will pull up a survey that you can answer a couple of quick questions on to give us feedback. Your feedback is important. Thank you so much for your participation.